Well, for more on this topic, I spoke to John Zhang. He's medical director at the New Hope Fertility Center. I started by asking about the general perceptions in China about donating sperm.
Based on my personal experience with my patients from China who unfortunately for many different reasons and they needed to use the donor sperm, and it's a very, very private matter, and they are almost feel embarrassed and to let people know they are using donor sperm. So in the old days, it's very common they would just use a brother's sperm, but for many couples, they don't have a brothers, so they have to looking for the donor sperm. So because this is a cultural background and people are so embarrassed about using donor sperm, so that's why sometimes make the procedure even more complicated.
And what do you think could perhaps help change that perception so that people get more comfortable?
I think, yes, with the education, with the development of the new culture, I think the new young generation start to become more and more open to using the donor sperm. And, as in the United States, we call it third-party reproduction, which, you using donor sperm, you using donor eggs, or using surrogacy mother. So it's become, I think for the young generation, it's become more and more acceptable.
Now, China is currently struggling with some insufficient sperm supplies. So when you look at some of the key factors behind that, what would you say are the biggest ones?
I think the biggest one, I think it's actually the two biggest factors. And one, obviously, it's a cultural background. Not only people are ashamed of using donor sperm, and not many people are willing to donate the sperm. So that's restrict the sperm source. But I do not think this is the major reason. I think the major reason is from the regulation, because in China, as compared with in United States, have way more strict regulation in setup of IVF centers, fertility clinics, and to license the facility to bank and sell donor sperm. I think it's a way too restricted. So this really reduces the production and the supply of the sperm. So I personally feel this is the two major factors.
And speaking of regulation, in China, it's public hospitals that have traditionally been primarily the main source when it comes to sperm donations. And then you also have perhaps around 24, by some estimates, sperm banks there. What do you think about perhaps encouraging more from the private sector and loosening some of the regulations?
That's absolutely right. I think, of course, we live with a very different ethnic background and social system. But I think the system that controls the fertility treatment in China is way, way, way too strict. If you go to the fertility center, at the center treated like 20,000 patients a year, you can't really provide a better quality. Why? Because there's such a restriction how many centers can be open in each city. So I think this is a major imbalance between the demand and the services we can provide it. I think if the government can losing the regulation a little bit, I think get the private sector get involved. The government just provided the guideline and provide the inspections and to let all the private sector to do what only now the state hospital to do. And I think that problem will be solved within 6 months.
Now, you also mentioned that previously people would turn to perhaps a brother, if there was one available, to be that sperm donor. So perhaps with this loosening out of the one-child policy, how do you foresee that changing the industry?
This is another very good question. I think the new policy of allowed to have a second child definitely going to affect the couples and definitely going to affect the demand for the donor sperm. But I don't think that will change it that much, because allowed to have a second child policy, it usually applies to the couple who already have a first baby. Usually the challenge is on the lady side. They are usually average age already above 40. The overall chance they get pregnant in this group of patients who really want to have a second child, the average age is already above 40. So what they really need is not the donor sperm. They really need the donor eggs, which is even more complicated issue in China, which is not allowed.
And just lastly, if you had to give people a message about overcoming the perceptions, becoming comfortable with talking about sperm banks, and really being open to some of these options, what would you like them to understand?
I really want them to understand that in the end, it's a process of raising a child between a loving couple. And I really don't think that where the sperm and egg come out is really play that important role. You know, we've been doing sperm donation and egg donation for the last 20 years. I see the couples are equally happy using their own eggs or donor eggs, using their own sperms or donor sperm. As long as they produce a happy, healthy child and they raise a very successful, happy human being, they really don't care less that where the eggs come from, where the sperm come from.
If you like what you just saw, follow us on social media and visit our website, cctv-america.com.